Hey guys, welcome to Tidbit Tuesday. Gorgeous day outside. Just enjoying some of the sunshine while working. But this week, I've recently had a lot of people be referred to me that have special events going on in their life. And most people have the misconception that if they have a qualifying event, that they can automatically sign up for health insurance. So this is not entirely true. So the marketplace rules are ever changing. And last year the rules were very different because we had open enrollment all the way through August. And then we only had a very short window that you weren't able to enroll. So if you were on unemployment last year or just needed to sign up, you could. So the confusion comes in where people think, well, I've gotten married or I've gotten divorced or I've had a baby. And a lot of times you can only make changes if you're losing coverage due to those life events. A couple of interesting situations now with someone with immigration status, and the immigration status doesn't automatically trigger an event. And then to top it off, the person is over 65. So they're bringing their elderly parent to come live here in this country so they can care for the parent. But the parent is not eligible for Medicare because they haven't lived in the country for 5 years. But the marketplace wants to know if they're losing coverage and why they don't have Medicare. And it's a whole thing. It's a whole thing. And so it's not always very simple. So I try to dive in deep and figure out, I'll go into the marketplace, I'll research it. There's no way for me to know every situation without having experienced it. And even then, it can be different. I'm finding what was one way before, it may not be the same way for another person. And so really, truly, each situation is unique. There's some general guidelines. If you have a life change event, we certainly want to explore to see if you're eligible for a special enrollment period, because sometimes income, this year they just changed it where income, if you make not enough money, you can have a special enrollment period all year long. You're not required to wait till November. So it's going to depend on your income, it's going to depend on your family household size, whether you're losing coverage, what your life event is. There's so many factors that play into that's why it's important to have an agent or a broker help you that understand the marketplace and know where to look for the answers. Because truly it's daunting to try to do this on your own because you may not get the right response. Sometimes I don't even get the response I think I should be getting. I have to go back and review the application and see, really truly dive into what they're asking, because sometimes they ask the questions in a way that you think you're answering it, but that's not the answer they want. For example, one of the questions is, do you have health insurance now? And it says in parentheses, if you're losing coverage before this date, mark the answer, don't answer yes. And I'm like, well, but I do have insurance now. So you have to pay attention to all the little quirks and the little fine print and parentheses, because that could help determine whether you're eligible or not to enroll. And you may erroneously enter something and make yourself either eligible, and then you find out later you really weren't, and you're stuck with the penalty and paying back subsidy, or you were eligible and you didn't enroll and you could have had coverage. So it's quite tricky. So finding an experienced agent is truly beneficial to you. Using an experienced agent does not cost you anything because we are paid by the insurance carriers. So your premium is not based on whether you use an agent or not. A lot of people also don't realize that you do not get a price break for doing it yourself. They just don't. Blue Cross, Aetna, all those people, they're going to charge the same amount of premium for you whether or not you use an agent. So they probably like it when you don't use an agent because they get to keep more money in their pocket. But it's very confusing, it's daunting, and that's what us agents are here for, is to help you navigate through that and help you pick the right plan that's going to make sense for the way you would normally use health insurance. So hop on over to my page, Shake Up Consulting. You can book an appointment with me through there to find out if you qualify for a special enrollment period. And until next week, peace out.